Good evening, Dr. Manu. Welcome to the show. I'm Dr. Smita, and this is Health Commune.
Good evening, Dr. Smita. It is always a pleasure to join you, and you are doing it for a wonderful cause. Thank you for having me with you.
Perfect. Before we get into today's topic, if you can help audience what you do, so they will understand why we have invited you for this speaking about implants for the day.
I'm a dentist and I have specialized in the dental specialty of prosthodontics. And prosthodontics is actually replacing the natural facial structures with the artificial one. And replacement of teeth is one of them. And replacement of any other missing part of the face is a part of the prosthodontics. Inside the mouth, the primarily replacement of the teeth through various modality, whether it is a denture, which is a commonly known term, or a bridge, or the currently buzzword is the dental implants. So primarily these are the modalities through which the replacement of missing teeth is done. And I'm serving with a tertiary healthcare center with a medical university. It's a teaching research institute. I'm senior professor and head and principal of the Postgraduate Institute of Dental Sciences in the state of Haryana.
Okay, amazing. So will I be right if I say that if anyone will have a dental issues, first they will probably reach out to their neighborhood dentist. If they have complications or some case that is really difficult to treat at a smaller clinic, those are the patients that are being referred to your center?
Yeah, that's very right, because it is the tertiary care center. Because the primary care is given at the primary center, then it is referred to the secondary, and ours is a tertiary care center, which provides the interdisciplinary and specialized care, and also it is a research institute. So, and that's why more of the innovations are happening over here. So all the complex cases are addressed over here.
Okay, perfect. And that's what the context I wanted to put, because I have never visited a tertiary care center for my dental health. I visit to my dentist, who's probably 10 minutes walkable. It's convenient even for my daughter. I just take her to the nearby dentist. When it comes to day-to-day dentistry, I probably go for like toothache, probably for my daughter's braces, or probably sometimes gums if they're hurting, and then otherwise for my normal scaling. But when it comes to implants, which is we are discussing today, what are the classic indications? What are the absolute indications of dental implants?
Dental implants, simply putting, is a device which is quite similar to the natural tooth in a way that natural tooth has a crown which is seen in the mouth, and it has a root which is anchored into the bone. So dental implant is a replica of the root of the tooth, which is embedded into the bone, and that serves to support the crown which is in the mouth. So that is the one modality to replace any of the missing tooth. It is quite similar in anatomy and the structure and the look-wise to a natural tooth. So whenever a tooth is missing, it can be replaced by a dental implant. However, every missing tooth is not an indication for dental implants. While choosing this option, one should be very careful, and any dentist should be very critical in deciding the case for the dental implants. Though currently this specialty or this dental implantology has quite advanced, but still it remains the artificial substitute. So it should be taken with a pinch of salt. Though success rate is high, but it has to be used very cautiously. However, there are certain conditions in which it is cannot be used. For example, like if the patients are undergoing some radiation therapy in the jaw area, or any other condition, any medications like biphosphonate, which affect the jaw bones. So if the bone is affected, in that case, dental implant may not be indicated.
Okay.
Also, a very simple thing, if the patient is not maintaining the good hygiene, that is also a contraindication for the use of the dental implant.
Okay. Take example of radiotherapy. Okay, assume that if a patient needs to have an implant because of probably any injury, any accidental injury, there is a missing tooth, and you need to put something over there, and it's an implant. And we do not know whether anyone, including me, would require a radiotherapy in future or not. Right? What's the way out? Because how we can actually think about the future and decide the therapy today?
When I take up the contraindication in radiotherapy, that is active radiotherapy. Once after a certain cooling period after the radiotherapy, when the bone stabilizes, then implants can be used. However,
Okay.
within the first year of the radiotherapy, the bone is more vulnerable. So in that case, it is absolute contraindication.
And when we talk about the absolute indication, it's like a missing tooth. What are the reasons missing tooth is there and for which the implant is indicated?
See, the commonest dental problem is caries. So caries is the one which dissolves the tooth structure, and slowly the hard tooth structure is lost. So when it is gone, that time only the root is left that is to be extracted. And the second most common cause is that the gum problem. Because the gum problem, any inflammation in the gum that affects the bone which is surrounding the tooth structure. So the bone surrounding the root of the tooth get affected, and the anchorage of the tooth in the bone gets loosened up, and simply the tooth exfoliates. So primarily these are the two main causes of the tooth loss. And of course, if there is a trauma or accident, in that
Yeah.
case.
Now, in your practice, what are the common three mistakes that dentists are doing when they are putting the implants?
The first and foremost is the case selection. One has to be, it is not that the tooth is missing, there is a empty space, an underlying bone is there, and implant can be put. No, this is not the case. The most critical mistake is case selection. If everything, majority of the success of the dental implants depends upon the correct case selection clinically. So if that case selection itself is not correct, then whatever is the best amount of best quality of the implant is used, that's doomed to fail. So case selection means one dentist has to follow some stringent and very robust criterias as far as evaluating the bone in which the implant is to be placed. And also not only that, only that area is critical. All the adjoining and remaining teeth in the same jaw or in the opposing jaw, they have a great influence through the chewing force. So all have to be evaluated, whether clinically that occlusion, when we say the contact relationship of the teeth, is that perfect or not? Because that harmony is to be achieved. The second important factor which the dentist should pay attention to is the systemic condition of the patient. Means what is the medical condition of the patient? We cannot plan the implant in isolation into the oral cavity. Once it is put into the oral cavity, it is connected to the body. So whatever is happening in the kidney, liver, heart, everything is going to affect the dental implant. So one should make very active efforts to dig out the history, because patient might feel, generally it is common observation, patient don't feel it necessary to disclose their other medical problems because they feel it is might not be directly related to the mouth. So a very thorough and very deep diving history is to be explored to find out what is the systemic status of the patient, because that is going to affect the long term success. And third factor I would like to add that do understand the dynamics in the mouth, because chewing forces are falling and they are absolutely dynamic and variable according to the each patient's. So we have to understand those forces and plan our dental implant so that it is best positioned to bear that forces. Otherwise, even the best anchored dental implant, if it is not in harmony with the biomechanics of the mouth, those forces are very deleterious and very strong. We understand that tongue is the strongest muscle in the body. So no implant, whatever best quality, best anchored, can withstand the parafunctional forces in the mouth. So dentists should consider the biomechanics of the chewing forces which is happening and which is going to affect the long-term survival of the dental implant. So these are the primarily three factors.
And when you mentioned about other systemic conditions, what are the one or two that a patient should not ever miss to inform to the doctor?
First and foremost, very common nowadays is the diabetes. So, what is the current diabetes status of the patient? Whether patient is diabetic or not. If diabetes is controlled or uncontrolled, and for how long period? Because diabetes has a direct implication on the wound healing.
Correct.
And when the bone is drilling is done, that's a sort of wound is created during this surgery. So that affects during the placement, and also later the bone health is affected by the diabetes. Gingival health is affected. So diabetes has a very direct linkage with the success. Another commonly observed is that smoking, because the smoke is passing through the oral cavity that causes heat as well as dryness, and that dryness affects the oral health. So these are the common things which a patient should immediately inform to the doctor. And of course, under the medication which the patient is currently taking, medication are always to be reported to the doctor.
Got it. Got it. In terms of if a doctor says that, we have to go for a dental implant now, and usually we just say that, okay, we never ask questions. So even if I am a medical doctor, if my dentist will say you have to go for implant, I'll not go for second opinion, and neither I'll go for, questioning whether it is required or not. Right. So in that case, how to handle this situation as a patient?
So first thing, discuss with your dentist that what are the options available with me. Of course, a dentist would discuss other options also. And then ask why this dental implant is better than other options.
Okay.
Because in other replacement options which are available for a missing tooth, there is a one removable prosthesis which can be given, which even the patient can remove at night. Another option is that where we just have to touch the adjoining teeth and we anchor the missing tooth over there, that we call as a bridge. However, for the dental implants, it involves a surgical phase as well. Other options don't involve the bone. They only rest either onto the soft tissue, the gums of the patient, or onto the tooth of the crown of the patients. They don't go deeper till the bone. This is the only option which actually drills and goes into the bone. And of course, this is a foreign body which is not resting onto the gums and the hard tissues. This is a foreign body which is actually going into the bone. So ask the doctor, is it necessary to put this foreign body into my body? Because anyway, foreign body, though we are using the most biocompatible material of titanium, it remains the foreign body. And the most critical factor, one question what the patient should ask, doctor, how to remove this implant? Because the God given teeth didn't last long for that patient. The patient lost the tooth which was given by the God. It means patient could not maintain the God given tooth. It means nature has created every part of the body to last as long as the body lasts. Or even if it has planned shedding of the teeth as a part of the aging, there's a big reason behind that. Because our GIT is also aging. We don't need such sharp chewing instrument for the hard food which the GIT itself cannot digest. It may be a logical answer that that's why the nature makes the teeth shed.
Oh, so nice, huh?
So we should not be asking that, is the implant going to last till 100 years of age? Okay, we can give. But can you digest that food which these implants are going to chew?
Correct.
So because of this reason, and if the patient could not manage the natural tooth, it is very not likely that patient will be paying that much attention to the implant also. And further, scientifically, there are not very robust scientific evidence to establish that they are going to last for 50, 60, 70 years. And if the patient is getting a dental implant at the age of 25, 30, 35, I do the planning till at least till the age of 100 years. Right?
Wow. Hmm.
So it may not be very logical to expect that no replacement would be needed. And only in case if there's a complication, implant falls off automatically, that's a failure. But in certain situation, it might need to be removed. So do ask what to do when it falls off or if it is to be removed. Because I get to care for personally, I attend the patients who are bedridden in the hospital, who are 90 plus or nearing 98 or 100 years. And at that stage, they are bedridden. There is amnesia and polypharmacy. They are taking multiple of medications. They are totally dependent on the caregiver or the family member. So in this situation, when I see the implants anchored into their bone, so the surgery is impossible sort of at a nearing 100. And patient is not in a position even to respond that he is having pain.
Correct.
So that retrieval has to be planned during the placement.
Correct.
So that is the question one patient should be asking.
Yeah, this is so interesting because assume that a patient is just 20 getting the implant.
Yes.
Will never think that one day I'll be 90.
You are very right. When I tell my patient, one 19-year-old young boy, I said, okay, what will you do? I said, I want to preserve your bone even 1 millimeter. What will you do when you will be 80 or 90? He started laughing.
Yeah.
Yeah, it is very difficult to perceive that.
Correct. And when we know that it's inevitable, but still we do not want to think about it. Whereas this implant is going to last for a very, very long time. It's not, it's a foreign body that has been implanted. Again, this is a very complicated situation. If a doctor is telling me, I'm probably a 19-year-old kid, doctor is telling me, let's get the implant. And I may say that, yes, are there any other options? But then if doctor insists by saying that implant kar lo, you don't have to worry because bridge and other things, you have to maintain it and other things, and implant is like the procedure is done, it'll be like a normal tooth for you. In that case, is it advisable to take a second opinion, especially from the tertiary care center where the awareness is there for long term goal of the dental health than actually the immediate fix that is required?
Dr. Smita, your answers lies in your question. You said the doctor would say that that is difficult to maintain, implant is easy to maintain. I
Yeah.
would say it is the other way around. Absolutely other way around. If I may say that the success of the dental implant depends upon 100% on maintenance, that won't be exaggeration. The other modalities like removable, easily maintainable. It is just like a specs. We wear it when we need it. We can remove it anytime. We can clean it, wash it. And when the patient is of a geriatric age group, old, cannot do, hands are affected with the arthritis, any caregiver can clean it. So oral hygiene is maintainable with the removable one. Whereas the maintenance of dental implant is very, very demanding. People take it, why this misconception? People take it easy because they don't maintain it. They don't bother about it. They don't clean it the way it should be cleaned. They neglect it. So maintenance of the dental, I will state it with an example of another implant. Somebody gets an implant of an artificial heart wall. Somebody gets an implant of a knee replacement. Same knee implant replacement is also made up of the titanium. Same over here, the hip replacement. But if any such replacement is there, patient remains very conscious of that part. They don't
Yes.
misuse their knee and hip, and they are running and bending, squatting, everything. And second thing, that implant is so well protected inside the skin, whereas the dental implant is directly exposed to the oral cavity, full of germs, full of food, their food for the germs. So dental implant is actually breeding, like living in direct contact with the germs. So how much of maintenance it requires? It requires special brushes, more number of brushing, more regular visits. So maintenance of the dental implants is more demanding as compared to any other of the prostheses. Patients are not paying attention. That never means that it is any less demanding.
But implant is quite common, right? It's not
Yes.
very rare. So is it like overuse kind of a procedure that is happening? What's your take on that?
Yeah, Dr. Smita, you are giving me answers side by side. You said the dental implant is common. No, it should not be. The patients may be because of availability of like information on the internet or the marketing or a reason. I come across the patient who are saying that, okay, this tooth is loose, or instead of maintaining, just remove it and replace it with the implant. Because patients, if they are having a knee problem, do they ask for the knee replacement at the first sign?
No, never.
Or more or less, if I tell my patient, maybe the same young boy of 19 years old, that at 80 years of age, you will require a knee replacement. Now you are young. Now you can tolerate the surgery well. Kindly get it replaced with the titanium. Titanium knee joint will not abrade. It will not get rusted. It will not get osteoporosis. Kindly get it done at the age of 20 years so that you don't have to get the age of 80 years. But then the patient does not accept. It is a matter of patient education. Same attitude should be adopted for the dental implants, that it
Beautiful.
should be delayed as far as possible.
Yes, exactly. Have you seen any patients reaching to tertiary care center, probably done the implant, and then some complications that happened that made you think that we have to create awareness regarding this?
Yes, absolutely. This is my day to day practice. The complicated cases, the failure cases, especially where the full mouth rehabilitation has been done, which is one of the most complex clinical situation, when all the teeth are missing and they have been replaced with the all are replaced with an implant, and that is the most difficult situation to maintain. That is the most difficult biomechanics in the mouth, which is difficult to control. And when they fail, this is our referral center, is the tertiary referral. We those cases, most complicated, we get to see day to day. And
Gee. Hmm.
definitely we treat them, but by that time it is already too late. The damage has happened. Patient has lost all the teeth or got extracted, replaced by multiple, and then not made so much educated to maintain the oral hygiene. However, ours is a teaching and the research institute. So patient education is a mandatory part for every patient at every visit. Whenever the first consultation is there, so patient education is a mandatory part. It is being done to every patient and also to the community whenever we go for the camps. So this problem is already realized and addressed with every patient to increase the awareness.
Okay. If I go a little more into clinical setup, right, to patient those who are hospitalized, and you are saying that they have multiple implants already been done. What are the clinical conditions? So apart from only the dental related thing, are there any medical conditions for which you also visit for dental checkup for
Yes,
those patients, and there are some complications that are
yes,
available? Yes. Mhm.
absolutely. Because see, as I stated in the first answer, that tooth, if we place the dental implant tooth, it cannot remain unaffected by rest of the body. So we here at the tertiary center, we provide interdisciplinary care, not independent in the dental department. So whatever department is in other medical departments, maybe it is surgery, some patient is going undergoing the jaw resection, or some cancer therapy, maybe for the jaw bones or tongue or the teeth or nearby throat and the neck area, and plastic surgery for the cosmetic burns area. So interdisciplinary care is a routine part of our treatment. It is always a teamwork, and team meetings are held so that to decide what is best for that patient.
Assume that a patient already have the implant. What are the warning signs that implant will create, and what patient should not ignore?
So I would start even before that. When the patient has some sign which he or she can notice, it means damage has already happened. It is already too late. So patient's responsibility is that no sign and symptom should happen, no problem should arise. He should or she should maintain the dental implant in such a way. And how is that possible? Through the regular prophylactic visits. So a dentist would definitely titrate that what is the duration of recall visit or the follow-up visit for that particular patient, depending upon the clinical situation, whether it is initially it may be monthly, 2 monthly, or 3 monthly, or 6 monthly at least. So whatever is the follow-up visit, without any signs, without any problems, patient should adhere to that. Because if the
Got
symptom has already appeared and patient is realizing something, it means damage has gone far. But with the dental implants, what the commonest problem are that generally the implant retained crown is either we cement it with a cement or it is retained with a small screw. And screw loosening is the commonest problem which patient might notice. So whenever any patient is having any screw retained implant restoration, so patient notices that screw is loosened or screw has come out, no need to panic. Just be aware that patient doesn't swallow it or aspirate it. It is a common concern. The screw can be replaced, tightened again, and patient should try to contact the dentist as soon as possible. And that is the reason the follow up. During follow up, the screw tightening is verified so that screw doesn't loosen and fall off. That complication does not. If screw has fallen off, it means the patient didn't follow the recall visit and the screw care was not taken care.
Okay.
So,
Okay.
and maybe even the patient doesn't bother or it is a cement retained. In that case, there might be loosening of the dental implant. Patient might feel, oh, doctor, this is mobile, or even the crown is moving little bit. So patient should be careful about it because if the loosening it gets more and more loose,
Hmm.
so it might give rise to a complication. Some fine day it might get exfoliated and patient might aspirate it. Patient swallows it, no problem. Just go to the dentist and measures can be taken that it is safely out.
Hmm.
And however, the complication may arise in case the patient aspirates. Only in that case. So loose implant should not remain unattended because it can fall off anytime.
It's a dilemma, right? Like whenever any good innovation comes up or any new innovating practices are being implemented in general dentistry. Okay, and as a medical practitioner, we are supposed to give advanced care to our patients, right? Like now, when we try to balance between innovation versus over treatment, Okay. Again, as a HOD, and you are teaching so many students and those who are becoming dentists and practicing over here, what's your suggestion to them, that how to balance, how to draw that line between innovation versus over treatment?
See, Dr. Smita, dental implants are not, they are very recent. They are not even 100 years old. So this dental implant industry is developing and the market is expanding. And it is expanding very fast. Every other day we see a new system with the new claims. Some say the structure is better, the anatomy is better, the material is better, the surface coatings are better. So with innovation, the young dentist might feel, okay, this is the best implant. And even if I compromise on my treatment planning or some details to the nitty gritties, this implant itself will take care of it, that it will get anchored automatically. It does not happen, right? So one should be very careful in selecting the dental implants. What parameters are specified in that particular brand? So, and what is the requirement of the patient? Just simply having a claim that this implant will remain anchored into the bone, that does not ensure the longevity of the dental implant. So, advanced, and moreover, as I suggested earlier, that there are not very long term scientific evidence to establish, especially with the newer systems. So, that's why the innovations are happening at a very fast pace, and the same way the marketing. And the another factor is that currently it is a costly treatment. And patients develop this belief anything which is costly is better, which is the biggest myth,
Yeah.
right? So it is not that this is the best one. Maybe that is the reason of overuse, as you said. So dentists should be aware of the innovation and patients should be make themselves aware of the overuse. Costly is not the best. It is the treatment planning that decides the what is best.
Perfect. Now, do you think modern dentistry is more focused on replacing than actually protecting or saving the natural teeth or denture that has been given to us?
Yes, you are very right that dentistry has advanced as far as replacing the teeth is concerned. So, patients are aware of the treatment options, that many treatment options are there. Most recents are there. Technology, material, machinery, everything is so advanced. Dentistry has become fast, comfortable, and aesthetics. But that never means that the preventive aspect is missing. Simply, patient is not aware of the preventive aspect, and that is why they are not paying attention to the preventive aspect. So preventive aspect is equally developed. If somebody aware goes to the patient for regular checkups, and even the slightest change or the very beginning of a disease is noticed, there are measures to correct it. Even that start with from the child. If the child is having like more caries, they were going to eat sweet and like that. But if the dentist notices some pits are there which are very deep and which are very difficult to clean, there are pit and fissure sealants. A very simple thing, one small application of a outer coating of a material will protect those teeth. And same way for the old age patient, SDF is the one that can be applied. So there are many preventive materials are available. And another thing is, suppose one tooth is lost. So the contact relationship, all the remaining teeth is altered because of the strong chewing forces and the biomechanics in the mouth. One missing tooth, a gap is created, the whole dynamic changes. So in that case, if one tooth is replaced, that maintains that integrity of the whole dentition, the whole arch.
Correct.
So that is a preventive. Not getting a single missing tooth replacement is causing further deleterious effects. Replacing it timely has a preventive aspect. Because the patient is chewing efficiency is not affected, patient is not bothered about missing one tooth. It is not simply the loss of, because patient won't be having compromised chewing unless many teeth are lost. However, even with the missing one tooth, the biomechanics is disturbed and the whole dynamicity in the oral cavity is disturbed. So replacement of teeth is not only adding to the chewing efficiency, but it is preventing the further deterioration. So there are every measure available for preventing anything. However, patients are not much aware. That is why it appears that dentistry is only curative and not preventive.
Correct. But we don't have any national policy or any school health program which does the regular dental checkup, or any corporate health program which makes sure that we check it. Do we have anything of that
Yes,
sort?
yeah, we have a national oral health program also. And you mentioned about the school health program. Every dental school has the responsibility for that. There is a one specialization of the dentistry which is dedicated to address the needs of the community, not only in the institutional settings. They go out and serve in the community. So those are educational camps, motivational demonstrations, and treatment camps. So those in the schools also, school health programs are run by various organizations, including every dental school. So that is a routine part of training, because our dentists are to be trained so that later they can serve the community. So if they are to be given the training to serve in the community, so for that practical training, they are taken out in the community and they are trained over there. So community service aspect is already there. School health programs and treatment and checkup, they are routinely being done. Maybe it is not to that large extent that it is evident, or maybe the patients and the children, they are not taking it, so unless until there's a pain they won't pay attention to it. That education is to be improved among the community.
Okay, okay. When we talk about again the tertiary care that you are involved in, which one was the most complicated case that you have seen, which you won't be able to forget regarding the implants?
See, one case was referred from somewhere, and he was around 45 50 years of male, and he had all the teeth missing, and all the teeth were replaced by dental implants in the lower jaw and the upper jaw. And there are different modalities, they all were fixed. And a very unique, if I may say wrong, doing was the whole, all the teeth of one arch, one jaw, they were attached as a single anchored unit. So one piece of horseshoe shaped metal was there inside the oral cavity,
Oh my God.
in the upper and the lower jaw. And what happens? The patient is not maintaining the oral hygiene. Then you imagine how many gum problems around each implant patient had the gum problem. Gum problem means inflammation, swelling, pain, bleeding, pus. There were full arches, 28 loci where there was a problem,
Oh my
and
God.
there was no solution. Solution was to remove it. But the
Oh,
planning was, generally it should have, as the nature has given each tooth individually, separately, we can address its issue. But that was just one block of hard titanium, and titanium is very difficult to cut. Even the diamond burrs cannot cut it. And patient said, doctor, just remove it. It cannot be removed, it cannot be cut. If we cut the titanium, how much of heat it will generate? Have you ever seen cutting the iron in the roadside where there's a spark?
yes.
That is iron being cut. It was titanium, harder
Yeah.
than that.
Right.
My job was to cut and remove it. Other option was that whatever were the few implants were loose, but few were anchored well into the bone. They cannot be removed. If it would have been single implant, I could drill all around the implant and remove it. But it was the whole arch, single one. So even each implant could not be. The only option was to cut off all the bone in which the implants were anchored, and that was the only option that can be done under GA.
Oh
So
my God.
patient was in pathetic pain, and it was a horrible situation. And another one was like I discussed, that one bedridden patient I still remember, in amnesia, lying down in the bed, totally non-cooperative. Hearing was lost, and two implants were projecting beyond above the gums, because patient had discontinued denture now. Patient was not, and still those two, if I may say, nail-like structure were projecting into the mouth, and patient was not even able to close the mouth because those were impinging upon the upper jaw. So at that stage, it was itself a big trauma to remove those implants. And the solution to it is that whenever we are placing, as for the patient aspect, patient should ask how to remove it. Same way, the dentist should have some back off policies, that in case the implant is not successful or to be removed, what are the back off policies? For example, like when we are putting an implant, sometimes it is into the bone and a part of it is coming out of the bone, one piece. So one solution is that we can use two-piece implant so that there's a junction between the portion of the metal implant which is in the mouth and which is in the bone. So when not needed, we can remove the metal portion which is into the mouth and we can make it a sleeping implant if we can not remove it. We cannot do the surgery. So some back-off strategies policies should also be incorporated in the design of the implant and in the treatment planning in case the failure can be addressed in a smooth way.
Perfect. Perfect. But then whose responsibility it is? Is it a dentist's responsibility to plan 20 years in advance, or is it a patient's responsibility to get that preventive aspects known, or have that knowledge? And whenever it has been suggested to them to go for any permanent treatment, we are today talking about dental implant, could be anything else, anything that will stay for at least 20 years down the line. Whose responsibility? Who is more responsible?
It is totally the responsibility of the dentist. They have to do the ethical practice.
Yes.
And without having much of the experience and not jumping that it is such an easy thing to place the implant. It seems easy. We have wonderful anesthesia. We have very high speed running drills. We give the anesthesia. Patient is comfortable and drill any amount. So it is convenient. That never means that one should feel very enthusiastic or over enthusiastic to do it. One should be very conservative. We have the drills which are running at a speed of lakhs rotations per minute, but that never means that we keep on drilling. Our dentist aim should be how to drill minimally so that maximum of the bone is preserved.
Perfect. Because I think we are discussing about responsibility, and this could be my last question for the day is, assume that a doctor suggests me for an implant. I come up with the complications. Can I go back and sue the doctor? Probably 10 years back, they have done the implant. And today I am facing.
Not particularly implant, that is true for any treatment. See, medical negligence is a definite topic, and that is addressed in a very structured way. That can happen in any procedure. That can happen in a denture also, or any other replacement of the tooth also. So it is not the negligence. And one good thing is that patient can educate themselves through the information which is available everywhere. Any person who can read and who has internet, so information is available in a layman's language. So
Yeah.
patients should educate themselves a little bit and then be in a position to discuss what are the treatment plans, what are the pros and cons of each treatment plan, and be participative in deciding the treatment plan.
Exactly.
If done appropriately, then it is a wonderful treatment, no doubt about that. But both dentist as well as the patient should be very critical in choosing this treatment option and explore all the pros and cons. They should be known to both doctor and the patient so that everybody is aware. It's not doctor, you do whatever you feel like. No, then should educate themselves or ask enough of questions to clarify their doubts. How safe is this treatment is? What is good about it? What is bad about it? What I'm supposed to do about it? What I cannot do about it? So ask questions so that there is clarity and good treatment planning for the dental implant.
Yes, because you said before, planning for patient, it's the dentist's responsibility. And here the planning is not happening for 1 year, 2 years. It's happening when I'm 80, 90. And what
No, I'm planning 100 plus years,
Right, 100.
not less than 100.
Yes, I have to plan when I'll be 100. Any important message you want to give it to patients, parents, or people, those who are listening to our podcast today?
Yeah, as far as the topic of dental implant is concerned, don't compare it with the natural tooth. Patient thinks that advancement is there, that I will get even better than the natural tooth. No, whatever the human beings, I would still say that human beings cannot create what God has created. We just can't beat it. So always treat it as a foreign body. Accept it that this is a foreign body, and maintenance is very critical. But the good thing is maintenance is very easy. It is very easy. Simply keep the mouth clean. That is it. It is not a costly affair, but the patient has to do it religiously, regularly. Maintain the oral hygiene. Visit your dentist as suggested. Don't neglect it. Then it is wonderful. Maintenance is everything. Otherwise, it's a foreign body.
Okay, got it. And I hope that we'll be able to work with you if we get the opportunity to work on some dental preventive options that you said.
Sure.
Those options that are there, and if we can get the opportunity to do some school programs or some awareness program, I'll be very, very happy.
Sure.
Thank you for your time, doctor.
Thank you so much, Dr. Smita. It is very lovely talking to you as always. Thank you so much.
Thank you.